Pentavalent. Pentavalent vaccine is a combination of DPT, hepatitis B, and Haemophilus influenza B. The pentavalent is included in the Universal Immunization Program in year 2015. In DPT, the diphtherial vaccine contains the diphtherial toxin, which is inactivated in formalin and adsorbed over the aluminum. The quantity of diphtherial toxin in diphtherial vaccine is expressed in terms of limits of flocculation. The primary immunization, which is provided in 3 doses, induces immunization satisfactory immunization responses in case of diphtherial toxin and tetanus toxoid, but the response is lesser in pertussis vaccine, and also it wanes off by 4 to 12 years of age. Therefore, the booster dose is recommended to maintain the efficacy in the adolescent age group. The adverse reactions are pain, redness, and fever, and all these are attributed to pertussis vaccine. The contraindication for the vaccines are progressive neurological disorders and also the anaphylaxis to the first dose. The individuals in which the DPT is contraindicated, we continue the immunization with diphtherial toxoid and tetanus toxoid with the same doses, and only the pertussis component is lacking. Then, to overcome the side effects of whole cell pertussis vaccine, we developed many new acellular pertussis vaccines, and these vaccines contain inactivated pertussis toxins, then pertussis antigens, and fimbrial antigens and non-fimbrial antigens. The efficacy of acellular pertussis vaccine is similar to the whole cell pertussis vaccine, only the side effects are lesser. But the recent studies have shown that the efficacy of whole cell pertussis is more than the acellular pertussis vaccine. Therefore, the Indian Academy of Pediatrics recommends the use of whole cell pertussis vaccine in the primary immunization, and booster dose can be of whole cell pertussis vaccine or of acellular pertussis vaccine. Then we have hepatitis B vaccine. Hepatitis B vaccine contains the surface antigen, that is Hep B S antigen, and it is the efficacy is more if it is given at birth, then at first month, and then at 6 month. But the regime which is recommended in the universal immunization program uh, includes the vaccine at birth, then at 6 week, 10th week, and at 14th week. This is to ensure the compliance and to decrease the number of visits. We provide hepatitis B vaccine at birth if the Hep B status of the mother is not known, and if the Hep B status of the mother is known, we provide the active immunization, active vaccines, and also passive vaccine within 24 hours in the different sites. Also, the combination of active and passive vaccine decreases the risk of transmission by 90% in patients with needle stick injuries or patients of sexual exposure, etc. It provides the long term immunity, therefore, the booster dose is usually not recommended. Then we have Haemophilus influenza B vaccine. The Haemophilus influenza B vaccine, the Haemophilus influenza leads to pneumonia, meningitis, bacteremia, and the vaccine decreases the rate of pneumonia by 33%, the meningitis by 90% related to Haemophilus influenza B. The vaccine contains Haemophilus influenza B capsular polysaccharides and polyribosyl ribitylol, which is conjugated with tetanus toxoid or diphtherial toxoid. And the vaccine, either given as a monovalent or in combination with DPT and hepatitis B, is safe, and the efficacy is good, and it is 85 to 95%. And the dose we give is 0.5 ml intramuscularly in anterolateral aspect of the thigh.